The Medical Student Education Series, Core Orthopedics, all about orthopedic pathology. Paget's disease, a viral infection of the bone where it becomes disorganized, thickened, deformed, and may cause OA, common in the UK, Australia and New Zealand. It can also be cardiac and nerve problems. A large deformed femoral head, secondary OA, immature woven bone, advanced OA requiring hip replacement. Infection. Infection in orthopedics may occur in the bone, at the end of the bone, that's osteomyelitis, or in a joint, that's called septic arthritis. Treatment is rest, hydration, identify the right organism, immediate washout of an infected joint, and perhaps surgery for osteomyelitis if it doesn't respond to antibiotics. Osteomyelitis case, young man, car accident, look at this deformed tibia, close-up view, been washed out, debrided, reduce hold with external fixateur. 1 to 2 months later, red, hot, tender, patient feels unwell. A little bit of dead bone found there, called a sequestrum, it was removed. Gout, disorder of metabolism related to high blood levels of uric acid. The crystals are deposited in and around joints, punched out lesions. Here they are in a knee joint, pseudo-gout crystals, destroying the joint, causing OA. Gouty olecranon bursitis, 43-year-old man, large gouty tophus, excised. There it is, safely in the pot. Here's a tophus in the region of the big toe, excised. Loose bodies in a joint, a knee. Here it is, floats around, causes the knee to lock. Here I am at arthroscopy removing the loose body. Here the loose body safely deposited in a pathology pot. Morton's metatarsalgia, pain in the foot, in the toes, repeated trauma to digital nerves, usually web space 3-4. Patient feels as if they're walking on a pebble. May need to excise. Here's a case between toes 2 and 3, excised dorsally, there's a specimen, safely in the pot. Freiberg's disease, AVN, metatarsal head second, unusual, teenagers, older patients. Sometimes you have to excise the head. Here it is in the pot. Dupuytren's disease, autosomal dominant, abnormal proliferation of the myofibroblasts of the palm, causing cords, bands, and deformity of the digits. Treatment is largely surgical. Excise the bands. Sometimes you have to amputate a badly deformed digit, as in this case. Here it is, excising the cords or bands. Here this required the excision of the digit. Baron Dupuytren, find a statue in Paris, go to Notre Dame Cathedral. Before you go in, rotate 180 and you'll see large statue of Baron Dupuytren. Osteoarthritis, it just means loss of the articular cartilage of a joint. Nothing special, that's a simple definition. Here's a view at arthroscopy. You get arthritis from abnormal cartilage, abnormal bone, where the bone has died, or abnormal loads across the joint, often from childhood deformities or trauma. Here's the knee replacement. Abnormal loads across the joint from deformity. Here's a dysplastic developmental dysplasia of the hip from childhood, CD8. Deformed head, secondary OA in the 30s. Here's a deformed head from Perthes, form of AVN, total hip replacement in the 30s. Here's destruction of a femoral head, radionecrosis, after radiation for cancer. Here's AVN of a head from trauma, pin and plate, young man. Here's an unusual cause, dermatomyositis, causing destruction of a hip joint, secondary OA. Again, another cause from abnormal loads, slipped upper femoral epiphysis. Femoral head slips off the top of the hip joint. You have to put a pin in situ. So-called pistol grip deformity, secondary OA. Another one, AVN, caused from steroids for a skin condition, large osteochondral flap, secondary OA, required a hip replacement. Here's one for you. Which knee are these two menisci from? This is a common exam question. Look at them carefully. Well, the one on the outside is a lateral. It's smaller, C-shaped, fits inside the medial. And at the front ends tend to be closer together than the back ends. That's the way you tell which knee it is. And here's one for the gold medal winner in the class. Black pigmentation on the articular cartilage wears quickly from secondary OA. It's from deposition of homogentic acid crystals into the joint. Ochronosis, alkaptonuria. Well, this ends this series. Look out for the next talk in the All About series and the Core Orthopedics and the Medical Education series. Thank you for your interest and attention.